So, what is depression? A lot of people come in to see me as a therapist and other clinicians in my practice and feel like they might be struggling with depression. Whereas I see actually a lot of people come in for other issues that technically could be or end up being diagnosed with depression. And I wanted to kind of speak about the difference between someone who maybe thinks they're depressed and maybe someone who actually is and has no idea that they are. I feel like it is a very common misconception nowadays for someone to actually be struggling with depression and not be aware of it. And the reason why I say that is because most people think of depression as something that is, makes you sad, you cry a lot, maybe you have trouble getting out of bed, loss of motivation, just don't want to do anything. Lots of crying, just that's what we typically think about with depression. And I think that history has shown that is how we used to look at depression. However, what I find as a therapist and what I think is important for people to know is that depression shows itself very differently in different people. And although, yes, if you are someone who is in tears a lot and has no motivation, doesn't want to go out and do the things that you used to want to do, struggles to get out of bed, or maybe you're not sleeping very much at all, those are all very, very real symptoms of depression. But a lot of people who are struggling with depression actually experience a daily frustration, a daily sense of irritation, maybe feeling more on edge or agitated just by anything and everything. And so I'll get people into my office to talk about stress management, maybe even anger management, because I feel like maybe I have an issue with my anger and I'm always on edge and I'm snapping at my kids and can't stand driving on the road because everybody's stupid, whatever people want to say. And as I poke and prod a little more and ask some questions, what I find is that a lot of these people are actually struggling with depression and are in the midst of a depressive cycle. Now, when we diagnose depression, we are looking for, you have to experience symptoms for at least 2 weeks. You have to have a number of those symptoms to be present. But if you really think about it, 2 weeks of feeling kind of down in the dumps or really frustrated and angry, again, loss of motivation, difficulty concentrating, eating too much, eating too little, sleeping too much, sleeping too little. Probably most of us have dealt with that at least one time or another. But I do feel like it's really important for people to start noticing for other people in their life, if there seems to be a little more agitation or irritation or frustration than what is typical for that person, it might be a sign that they're struggling with depression. This could be you, it could be someone in your life. Now, if that is something you're concerned about it, absolutely, you should go and find somebody to talk to. You could talk to your family doctor or, friend or family, and you can get referrals for therapists there. Obviously, you can go to psychologytoday.com and look for a therapist there. Or you can just start paying attention, be aware. If I am someone who's snapping at my kids more, I just feel irritated, like every little thing bothers me. I don't know why. There isn't really anything going into my life that's making me feel that way, but it just doesn't seem to be going away. Then it is something that probably needs to be addressed. And so chances are there is a level of depression that I'm struggling with. Now, as far as treatment goes, every therapist is slightly different in how they might treat depression, especially based on how severe it is, because there's different levels of depression with people. But as far as the research goes, a lot of people don't want to seek out treatment for depression because they assume that a therapist is going to say, medication, here's some medicine, go talk to your doctor and take some medicine. That is not actually what most therapists do, and it's really not what they should either. Going and talking to someone about depression, or just inquiring, hey, can I talk to you and see if you think I'm depressed, and telling them what has been going on in your life, one, just having that support and a listening ear can be extremely beneficial for you. And sometimes that talk alone can really help alleviate some of the depressive symptoms that you're dealing with. That is why we call it talk therapy. But, going and talking to someone that's a therapist who's well trained in treating depression, the benefit of doing that is that there are so many things that you can do behaviorally, changing some of your patterns of behavior, obviously doing some work on your thinking patterns and whatnot. If you have some dysfunctional thought patterns, we want to work on those things. But a therapist has a ton of resources for you, ways that you can kind of pull yourself out of that depression on your own without medication. I will say for me as a therapist, that is where I tend to go first. And I want my clients to put the effort and the time in to try to make the behavioral changes to alleviate that depressive episode. Now, if they do that and it's been an extended period of time and maybe we're not seeing a ton of changes, or they're still feeling like they're struggling, they're not quite getting there, then medication might be something that I would refer them to their doctor to talk about. And it can be helpful. It's important to know that depression is very, very highly genetically inherited. So if you have parents, a parent, siblings, aunts, uncles, people in your family who struggle with depression, you could very well be carrying a gene that just predisposes you to struggling with it. And that's okay. It's just like any other gene that maybe, we don't want it, but if you have a genetic predisposition to some sort of cancer because it runs in your family, then we're going to be very careful about that. So it is important to know if people in your family struggle with it so that you know that maybe you might be more susceptible to it as well. But I will say, and I do want to really emphasize this, if you feel like you are struggling with some sort of depression, whether you're sad, someone who's more on that sad side of the spectrum, or if you're just mad all the time, and if you just feel angry all the time, either way, chances are there's some depression there. All the research recently, especially recently, has shown that the most effective treatment for depression is exercise alone. Exercise, physical exercise and activity, as opposed to, and what they have found in these studies is that the combination of psychotropics, which is medication that you would take for depression, and therapy combined is not as effective as someone who regularly exercises and gets physical activity. That's huge. So I think, so many people are unaware of that. And I always want to really push it. Now, I know I've struggled with depression myself. And I am aware that when we're depressed, the last thing that we want to do is get up and go work out. We just don't. When you're depressed, you have no motivation. It's hard to get up and do anything. But I think the education and the awareness of knowing that you have the tools, we all have the tools to be in a better headspace if you really push yourself to do it. And sometimes that is hard. And finding someone to keep you accountable, hugely important and definitely beneficial. But if you're struggling, maybe that's something you start with first. And there is also kind of this misconception about how, well, I don't know what I'm doing when I go to the gym, so I don't want to do that. It makes me uncomfortable to go to the gym because people are staring, or, I don't know what I'm doing, or I don't like lifting weights, and, maybe I just would rather take a walk. Great. Go and take that walk. Do what you feel comfortable doing, because exercise in general is not one size fits all. Exercise is meant, we're supposed to do it for our physical health anyway, right? But mentally and emotionally, it is so vital for our brain health, for our emotional health. And so go outside on a nice day and take a brief walk. You don't have to even get your heart rate pumping crazy or anything like that, but getting outside, getting some fresh air, take a bike ride, go on a jog, run if you like to, just go to the gym and lift weights, Get a couple dumbbells and lift weights at your house if you don't want to go to the gym or pay for a membership. Anything that you can do, march in place, is beneficial for your brain when you're struggling with something like depression. So I did want to kind of just talk about that today, because I hear it so often that people, there is this kind of stigma around going to therapy. Not as much as it used to be, but still a little bit. And so people don't want to go. Nothing's wrong with me. I don't have problems. And, depression is to me, it's just a very, very normal thing for all of us to have dealt with at one point or another. And so one, I want to normalize that. And then two, I want to tell you it's not a bad idea and it's not scary. It doesn't mean something is seriously wrong with you if you want to seek out help or talk to someone about whether you might be struggling with depression. Because in addition to the exercise, there is just so many other things that we can help you with that you could do on your own, and that would just give you a little bit of light at the end of your tunnel. The times where we feel really sad and we have trouble getting out of bed, or we just wake up mad every day and go to bed mad every day, that is not pleasant. No one wants that. And so if you have the control, you have the ability to make habits, new habits in your life and create change, why would you not do that, right? It's going to be beneficial for you. It's going to be beneficial for other people in your life. And I really hope that this helped give you a little bit of insight into what depression might look like for you or for other people in your life. Of course, again, Mental Health with Amanda. I am on YouTube, so if you're watching this on YouTube, like and subscribe. Also follow me on Instagram or Facebook if you prefer, and I will be posting more content soon. Have a great day.